guys study like all of this, but I will just tell you guys like the best way to prepare for it and what to put in your cheat sheets. Alright, so for the bones and skeletons, so you guys don't typically get a lot of questions on this topic, and that's why you see that there's quite a lot of topics in prac exam 2, and that's because you don't typically get a lot of questions on bones and skeleton, and the same as prac 6, which was your musculoskeletal system. Well, I think it's just like the muscular system and the joints. So you don't typically get a lot of questions on these two, and that's why they've merged it into the one exam. So the first important one is the chemical composition of bone. So this has been asked a lot in the past. So what you need to know is the organic versus inorganic components of bone. So the organic one would be your collagen, inorganic one would be your calcium carbonate, and also just make sure that you don't just write calcium because that will be incorrect. You have to specify that it is calcium carbonate, or you could also write hydroxyapatite, but this is probably like the easier one to remember. And also the properties that they have. So just make sure that you study organic versus inorganic components of bone, what properties they provide for the bone. So you guys can also like remember back to that experiment where there's the acid soaked versus the baked bones. Like what was stripped off of them, and that is the properties of these components. And then another one, so long bone, haven't seen much of this in the past, but I will just draw a little diagram of it anyway, so just something like this is okay. So you would want to label the different components, so for example the epiphysis, diaphysis, knowing the epiphyseal cartilage, which is your growth plate, and yeah, I would just draw this one anyways because I think it might be like a most likely surprise question. It might ask you something about the long bone. And then another one, so bones of the human skeleton, so I mean like they'll probably not ask you about like what is a tendon or what is a ligament. But the more important one I reckon that you guys should focus on is this bit here. Oops. So this one I've never seen in an exam either, but this is just like the different parts of the cranium. It's pretty straightforward in terms of the frontal, parietal, occipital, and temporal is located where you find those brain lobes. And then the nasal bone is like right by your nose, mandible is right by your jaw. So I mean a lot of them you can kind of just take a good guess if you see a diagram of it in the exam. But I mean it might not come out, I'm not too sure, but to be safe, you might be able to just write it down somewhere, okay? So you can either draw a diagram or you can give it like a little description, so like mandible, jaw, and these ones are where the lobes are, however you want to do it. And then the vertebrae, I doubt that you guys need to know like all of these parts, so don't worry too much about it. But what you might want to know is just like the intervertebral discs and how they are shock absorbers. But I doubt that you guys need to know any other parts of this since it's just like mentioned in passing. Thoracic cage. So for this question, it is talking about articulation. So this is going to be like the more important part of bones, I reckon. So with bones, like if you like go down to your books, you will see that skeleton model, right? So the skeleton model has all of the general, I guess, like skeleton parts that you need to know. So as long as you have something like this, even if it looks ugly, it's fine. Like as long as you can like identify, like this is the clavicle or whatever, okay? So make sure that you have one of these. It's just going to make it so much easier for you to suss things out in the exam. Again, like I think visuals help a lot with an exam that is only 1.5 minutes. Especially with bones and skeleton as well. It's so much easier to have things labelled than not. So have one of these, and then after that, you guys are going to be able to see or figure out articulations in the exam. So what articulation means is it's basically like where bones are meeting, okay? So if this bone is articulated with this bone, it just means that they are like meeting or joining together. Does that make sense? So you guys can suss that out like in the exam. You guys don't need to memorize this. But if you have the skeleton there, like if you have like a good diagram of it, then you can just split there and be like, okay, so what does a humerus articulate with? Then you can just have a look on your diagram. Okay, so that's a humerus. What is it joined up to? So that's like the easiest way to do it, so that if they throw you any type of bone, you can just suss it out on the spot, okay? Because I don't know what bone they're going to test you on, but I just feel like that would be the likely thing that they'll ask you, so articulation or certain things. So like the sternum, for example, right? So I think I told you guys this in the cadaver lab, but you saw that not all of the ribs articulate directly with the sternum. So it means that not all of the ribs are connecting or joining directly with the sternum. So yeah, and one of the structures that joins some ribs to the sternum, and that is the cartilage, okay? So they don't always directly connect. It could be through like a cartilage, for example. And yeah, you can put the sternum as an example if you want as well, just in case you get asked it. And then, yeah, so everything else here, it's all about articulation. So like with which bone does the clavicle articulate, there's more articulation. So yeah, again, if you have the skeleton labeled, you should be fine. And then you've got the pelvis. So the pelvis, the main thing that you guys need to know, so I doubt that you guys need to know every single part of this, but what you guys will be most likely asked is to be able to distinguish between female and male pelvis. So the female and male pelvis, so if you guys can imagine this sort of like V-like structure, so where it's like a V down here. So right by your pubic symphysis here, so so think about the gap difference and the tail protruding further for males and the V-shaped pubic symphysis. So there is a larger gap difference, so like down here. So the gap where that V is a lot wider in females because of childbearing, okay? So it needs to be wider. And meanwhile in males, I can't remember the exact angle, but it is a lot narrower, okay? And also in males, it's got like the tail, like the coccyx, is like a bit more protruding, or it's like kind of more curved. So you can list down a couple of differences for them if you want, because you'll, like if you were to get asked a question like that, you'll have a pelvis in front of you and you just have to suss out if it's female or male, and you need to be able to give a reason why. And then that's like pretty much it for bones, like it's pretty chill. So it's just, yeah, diagram, composition, and yeah, articulations and stuff. Okay, so for the muscles and joints and stuff, so for the muscles, I'll show you guys in a sec, but it's going to be similar where you have to like draw like a diagram of, where the general muscles are. So what you're going to be looking at first, so again, it's like joints and articulation, surprise. So it's like the first two, so the bones and the muscle, they can overlap a little bit. So what you want to focus on is the different types of joints. So fibrous, cartilaginous, or synovial, but the one that's going to be heavily asked is the synovial joints, okay? Because there is more to talk about with them. So fibrous and cartilaginous versus synovial joints. Synovial joints is the one that you can freely move, okay? So that is the one that you can like freely move around, and that's why it's the one that is like more complicated. Because so what you should do is so learn and put down on your cheat sheet the 6 different types of synovial joints. So the different types of synovial joints, and also the movement that they create. Okay, so the movements that they allow. So if you guys remember, like the movement, so like flexion, extension, abduction, adduction, blah, blah, blah. So you need to know, so I would list down the 6 different types of synovial joints. I would also give like the movements that it allows and also some examples of where you would find those joints. So for example, like hinge joint, where would you find that? So like for example, like, you know, like in the elbow joint, whatever, like what movements does it allow? And if you see like an elbow joint or like a knee joint, and if you know, don't have any ideas what movement it allows, you can also demonstrate it on your own body. Like I've seen people like kick their legs and stuff in the middle of the exam. And I'm like, okay, I know exactly what question they're up to, because they're probably testing out what movement their knee joints allow. And same as the elbow, like they're just like, you know, looks like they're just flexing their elbows, but then that kind of gives you the answer, right? So allows for the flexion and extension. So yeah, so that is the best way to like study for the synovial joints. You can do it on your own body, and like the like I guess the questions that you'll get are going to be the more straightforward ones. So like, you know, elbow joint, knee joint, or like whatever that is obvious. But yeah, you can like obviously put examples of that. And then what else? So like obviously like knowing those different like movements, a lot of them are pretty straightforward, but just in case they're not, you can just, you know, write on your Okay, so now you've got the superficial muscles. So the superficial muscles, like I would say like everything is important, that's why I draw the diagram. Because it's just those things that's going to be super hard to memorize. And again, if you guys went to the cadaver lab, you've probably seen these ones especially, like your vastus lateralis, rectus femoris, and whatever. But I mean, it's just one of those things that you kind of learn over time. So it's going to be pretty hard to memorize. But just draw these two diagrams down here. So you'd have the one that is from the anterior view, and you're going to have the one from the posterior view. And an easy way to label this as well is that you need to clearly distinguish the different, I guess, like landmarks. So for example, for your tracks, it looks like it's like a, you know, like a triangle or whatever. So you need to put clear lines just to help you out in the exam, to suss out where each of those muscles are, because sometimes it can get confusing when they are super close to each other, especially these ones here, like knee or hammies. Like just make sure they've got lines like running through it so you know exactly where they are and it doesn't overlap. And then yeah, so here as well, so I've written down, I know the general one, so it's just everything that's on the diagram. And also the movement that it allows, okay? So the movement that it allows. So for example, your hamstrings allows for knee flexion. So you can also go up here. So it literally like tells you everything. So like your lats or your latissimus dorsi. So it's your broad triangular muscle that covers the lower back, and it is the primary muscle involved in arm extension. So that is your movement, okay? So the movement that it allows is the arm extension. So I want you guys to label everything like on the anterior and posterior view, and then you can just add like a movement for each one of them, because that's going to be the most likely question. I don't know which muscle, I don't know which movement, because that's just going to be something that you'll figure out when you go to the exam. But if you have that diagram, and you also have the movement for each one of them, then that's going to be easy for you to work out on the spot, okay? All right, so yeah, again with like bones and muscles and stuff, there's a lot of rote learning, but it is how you apply it that's going to matter the most. So it doesn't matter if you don't, if you haven't memorized like the sternocleidomastoid, like who cares, you know? It's like you will learn it over time if you're going to be doing a lot of anatomy. But it's the fact that, okay, so what movement does this muscle allow, whatever. Like you'll get like, most likely, you'll get like a muscle model in front of you, the ones that looks like the colossal title of Attack on Titan that you saw in class. You're going to probably get one of those, and then you're just going to have to suss out what muscle it is, and it's probably going to ask you for the movement, okay? There's really not much else in And that's why I'm saying that the bones and muscles are like not really a lot, because it's just going to ask you to like provide examples of stuff, okay? All right, so the gastrointestinal system. So we're getting into like the more sort of like lengthy ones. Not super difficult, but just a bit more lengthy. So what are the two examples of structures that regulate the movement of contents of GIT from one section to the next? So I'll cover this a bit more later, but that's your valves and sphincters, which are going to be super important. But let's start off with the simple stuff first. So there is the four tunics that make up the gastrointestinal tract. So if you guys can just like write down what they are, so like the mucosa, submucosa, or whatever. So you're gonna put down all of the layers. And an easy way to do this as well is, so you know all of the different organs of the gastrointestinal system, especially like here down. What you can do is, you can list down all of them, right? So list down all of them, probably not the diaphragm, don't really need to know. But like most part of the gastrointestinal system that is listed down here. So for example, down here you've got the esophagus, the stomach, the small intestine, large intestine, and gallbladder, liver, etc. So what you want to do is you want to be able to distinguish what characteristics do each of their layers have. So does the stomach have like an extra muscle layer or something in their muscularis externa to help with like propelling food and like the mechanical breakdown and stuff? So what you want to do is just like obviously know the functions of each of the organs of the gastrointestinal system, and also list down the difference that they have in their layers, okay? Because they will have differences in their layers. As you can see here, the stomach, what's distinctive about the mucosa of the stomach? So it's probably going to have something to do with protecting itself from like all the acids, okay? So you can do that, list down the functions, and you should be like pretty fine. And then also obviously know what the organs look like, because they're not going to say, what does the stomach do? They're going to give you a plastic model in front of you, and they're going to be like, oh, what's the function of this organ? Or what is distinctive about the mucosa of this organ? So you obviously need, so you're not going to get asked about the spleen. So if it's an organ that you've never seen before or learned in the class, you're most likely not going to get asked anything about it. But there's a disclaimer though. There's going to be a station that heaps of people, like if I don't give you a heads up, are going to be like, oh my god, I've never seen this in my life. So there's a station where there's just like a massive blob of liver just sitting there like for no reason, aside from just like decorations, I guess. So if you guys remember back in the respiratory prac where there's like that massive like trachea and like lungs and like heart, and you've got like liver down the bottom, do you remember that? Yeah. Like in the respiratory tract. So because we get those from the butchers, right, and we're also going to have like lung models, lung dissection models, not a lot of them, but like one, then we have a liver, right, that's still attached to it. So they snipped it off and they just decided to just chuck it on one of the stations. But it's not going to get you to identify any regions of that dissection. It's just trying to get you to realize that, okay, that's a liver, and it's going to ask you something, for example, hepatic circulation. So if you guys remember, like the blood flow, like from the small intestines to the liver, goes through which vessel. So it's not going to ask you anything about the appearance of the liver, or like, you know, it's not going to pin anything on there. It's just going to be there. So yeah, you just have to know the fact that that is a liver. Because a lot of people wrote diaphragm in the past, and I know it's like this sounds like a bit like common sense. So it's not because I think you're dumb, it's because a lot of people under stress, they might mistake things for other things. So if you see a big blob of brownish red, it's not the diaphragm, it is the liver, okay? Alright, so the esophagus, so let's start from the esophagus. So So what's distinctive about the composition of muscle tissue? So similar as what you'd write for all the other stuff, so the different characteristics of it, and why there's the distinction in the esophagus. So this one's pretty interesting. So a lot of the muscle tissue that you find in the GIT is going to be smooth muscle because they are involuntary. So they move on their own, they contract on their own, because obviously we don't control most parts of our body, right? And that's why they are lined with smooth muscle. But the esophagus, so the way that this is different is that they've got different muscle tissue. So at the top portion of your esophagus, because you're swallowing, that is voluntary control, that's going to be skeletal. In the middle, you're going to have both skeletal and smooth, and then down the bottom, the one that's attached to the stomach, that's going to be smooth muscle because you don't control that. So that's the main thing about the esophagus. We're probably not going to get much else if there is any on the esophagus. The stomach, as I mentioned before, just like talk about the distinctive parts of the mucosa, and also the muscularis externa, like is there like an extra layer in the stomach, and also the implications of it. So yeah, so as I mentioned before, general characteristics of each organ, and most of the ones that are involuntary are lined by smooth muscle. So yeah, it's not too complicated. And the small intestine, so for both small intestines and large intestines, you're obviously not going to get a dissection model because that's going to be a bit messy. If you guys remember the cadaver line, just kind of below the shot. So we're going to most likely ask you questions of that on the plastic models. So just be mindful though, like especially with the large intestine, if they ask you, like if there's a sticker on like a certain part of the small or the large intestines, you need to specify the specific part. So if we have a sticker on like a part of the large intestine, don't just say, oh, it's a large intestine. It's like, great, but it's like it is correct, but you need to specify, is it the ascending colon, is it the transverse colon, is it the descending? Like you need to actually specify the region, okay? Because the amount of times that I've seen like large intestine on there, like instead of specifying it, and you're just losing like really silly marks. And same as the small intestines as well. So you have the duodenum, jejunum, and the ileum. You need to specify which one. What else? Yeah, so obviously just like talking about the distinctive features of each one. And your small intestines are also folded as well to increase surface area. And then, so for the liver and the gallbladder, so the most important bit of this is this sort of scope here, okay? So it is, I guess, like the fate of bile. So bile would be produced in your liver, okay? So liver produces bile, and the liver will then send over that bile to your gallbladder, which is that sac that is underneath your liver, where the bile just kind of chills there until it needs to be released. So when you are eating food, it's got fats in it, then bile is going to be sent through or secreted to your duodenum. So again, like please be specific and say duodenum, not the small intestines, because duodenum is the first part of your small intestines where the bile is secreted. Okay? So please just be careful when you are specifying that. And the function of bile, so there's a fancy word that Marcus usually likes to see, is called emulsify. So if he asks you, what is the function of bile, it is to emulsify fats, okay? So just use that fancy word. It's almost like if you're like doing your dishes, right, and you've got like greasy stuff on a plate, your detergent will emulsify the fats that are on there. So that's technically what bile is doing in our body as well. Alright, so moving on, so hepatic circulation. So as I've mentioned before, you're probably going to get asked this, and then if you have that blob of liver, it's either going to be something to do with the circulation, the function, or whatever, something to do with the liver, but probably not so much the structure, okay? So hepatic circulation, so all you need to know is when blood is coming from a certain organ to the liver, which vessel does it go through, okay? Like the hepatic artery, hepatic vein, etc. okay? So you just need to list that down, and there's only a few of them anyway, so it's not too bad. So what vessel supplies blood to the liver, what vessel drains blood from the liver. So it's very similar to like kidneys and stuff. You just need to know which vessel these blood's going through. Literally just write on your cheat sheet. And then the pancreas, so this one, like I'm not 100% sure if it's going to be asked again, but I think Artie is going to be like, oh whatever, ask them this in the endocrine, I'm just going to put it back in anyway. That's how I think he'll do it. But the endocrine function versus exocrine function, so that's like always asked in regards to the pancreas. I don't know if anyone in this class like wrote this down, but so the endocrine function, right? So that is both releasing insulin and glucagon, because I've seen some answers, like not from this class, but I've seen people write releasing glucagon as exocrine and releasing insulin as endocrine. So endocrine just means that it is released into the blood and it is mostly in a form of hormones, okay? So exocrine is usually done through like a duct or something like that. And in this case, it would be pancreatic juices or pancreatic enzymes, okay? All right, so what type of tissue makes up the bulk of the pancreas? So it's actually your exocrine tissue. The role of pancreatic exocrine secretion, so again, this is like pancreatic juices and stuff. And then you might also get asked for the cluster of endocrine tissue. So if you guys remember, like under the microscope ages ago, you saw like those island of cells. So it's called islet of Langerhans. I would just like note that down somewhere anyway. Just in case Artie's like, I'm not going to ask you some questions. I'm going to like reword it a little bit because I still want to ask them about the pancreas. It's probably going to be about the cluster of endocrine tissue, which is your islet of Langerhans. Alright, so just like final notes that are really important. So valve and sphincters are very important, okay? So if you guys remember those like slides that I went through, where we went through like the gastroesophageal junction, the pyloric sphincter, ileocecal valve, and the anal sphincter. So I'll just sort of give you a breakdown. So if you were to get any questions on valves and sphincters, you're going to get given an organ where those valves and sphincters are located. And then you also need to know the terms, again, proximal and distal, okay? So proximal is going to be the one that is closer to the ovum, or like the beginning, and then distal is the most distant. So if you have like a stomach model in front of you, then the proximal end of your stomach is going to be the one that is closest to your mouth, right? So it's going to be the one that's attached to your esophagus, which is gastroesophageal junction. And then at the end, at the distal portion, it's going to be your pyloric sphincter, okay? And then you need to put a function on each one of them as well. So just know where they are, put a function. And then ileocecal valve, that's going to be the one that is between your ileum and cecum, so between your last bit of your small intestine and first bit of your large. And the anal sphincter is going to be the one that helps you control your stool, okay? So if there is anything sphincter, it is usually, a bunch of muscles that controls the release of something. So pyloric sphincter, it controls the emptying of your stomach through those muscles, and anal sphincter, it essentially controls your poop, okay? All right, so that's basically it for GI. So respiratory, just make sure that you know each one of these and where they are. I mean, like the nose and nasal cavity and sinuses will probably not get asked because it's like pretty obvious. The pharynx is just your throat. You'll have your larynx, which is your voice box or your vocal box. And then just know the functions of all of them. And then you've got the trachea. So the trachea, remember the characteristics of them. So you've got those cartilages that holds your airway open, okay? So hold your airway open, and then you've got your three different types of bronchi. So you've got your primary, secondary, and tertiary, it's like the little teeny tiny ones. And then at the very end you'll find the bronchioles, but they're microscopic, so you won't see them in the dissections at all. And then you've got your left versus your right lung. Another important thing is knowing how many lobes there are in each lung. So your left lung will have 2, your right lung will have 3 because it's bigger, and the left one is smaller because it makes room for the heart. And you also need to know the names of the lobes, okay? So it's pretty easy. The top one's superior, middle is middle, the bottom is inferior, okay? So just know those ones. And what else? So the epiglottis, I don't know if you'll get asked that, but I will add it in anyways. So that's that flappy elastic cartilage that flaps open and close when you're eating, so that it doesn't go in the wrong tube. Okay, so that it goes down the esophagus and not the trachea. This whole page is important. So the trachea and your primary, secondary, and tertiary bronchi. So all of them are lined by cartilage in order for that airway to stay open so air can go through it. And then after that, your primary bronchi, again, it's a big one, and then branches into secondary and tertiary. In your dissection model, it's probably going to be like super hard to find your tertiary. So if it is like at the top of where the holes are, like if you guys remember from that prac, it's probably going to be primary, and if it's like towards the middle a little bit, that's probably going to be the secondary. Okay. And then what else? Okay, and another thing, so know the epithelium that lines your trachea. So remember, it's got cilia, so it's ciliated, and it's pseudostratified columnar because it secretes mucus, epithelium. Okay? Okay, let's go down to, alright, so that's another like really important point. So you guys need to be able to distinguish, again, like very similar to the kidney one, what the name of the point of entry of the primary bronchus into the lung is versus the point of bifurcation, because people get this wrong. So the point of entry of primary bronchus into the lungs, so that's where this enters into the lungs, so that is the hilum, okay? But meanwhile, the point of bifurcation is this point here where it branches into 2. So that's the difference. Bifurcation is branching into 2. Point of entry is when these branches enter the lungs. So the point of bifurcation, that is called the carina, okay? C-A-R-I-N-A. And then, yeah, I mentioned before about the lobes. And then another thing is the alveoli, so that's like the end point of your respiratory system because that's where you have gas exchange. So you need to know the 2 different types of alveoli cells. So type 1 is the one that's just like resident and just chilling there, but type 2 is the one that secretes surfactants. So surfactants are the ones that reduces surface tension, okay? So the ones that secrete surfactants are type 2. And another thing as well, so if you could imagine that the alveoli is like little air sacs, right? So CO2 and O2 are like constantly going in and out. So you want the walls to be thin, okay? So please note down the epithelium of alveoli, which is just simple squamous because it's like super flat and it's only 1 layer of cells. Okay, and like, I mean, this is just like what we've mentioned earlier. It's like, you know, some properties of the trachea versus some properties of the alveoli. So, yeah, this one's also very important. So the parietal versus visceral pleura. So the visceral pleura is the one that wraps around your lungs directly. So these things are serous membranes. So when you remember the lung dissection, there's like shiny coats or like a shiny membrane. That's your visceral pleura. So in general anatomical terms, visceral means like internal organs related. So visceral pleura wraps around the lungs directly. Parietal pleura is attached to your chest wall. Okay, so that's the main difference. Alright, so now we're going to go into the spirometry, which is like the last part of respiratory. So what you guys should know is this graph. So you need to know FEV1 and FVC. So when you guys are answering these questions, I want you to put the full name. So forced expiratory volume per second and forced vital capacity. And then what it measures is also important and where you find it on the graph. So FEV1, you can see here that it's at 1 second. So this curve here, that will tell you how much volume or liters of air is being expelled in 1 second. FVC is your forced vital capacity, which is how much air your lungs can actually take. Okay? So it's going to be the highest reading that you find in the curve. Yeah, so literally just knowing what these are and then where they are on a spirometry curve. And then very important, so your obstructive versus your restrictive disease. So what they look like on these graphs, okay? So what you can do is you can literally just sketch this graph and then put all three of them in this one graph. So normal versus obstructive versus restrictive trends. So you can see that obstructive is like going up slowly. The FVC is not too low, it's like almost normal. But the FEV1 is like really low because again, it is an airway obstruction. So things like asthma, right? Like people can't breathe in and out very fast because their airways are super narrow. So you can see this slow rising slope. Meanwhile, the restrictive disease, it's like both FEV1 and FVC is really low, okay? So you guys want to write those down, so being able to differentiate it. And then that's it for respiratory, and I mean, urinary system is pretty much everything I've mentioned to you guys today. So this whole page is relevant. Make sure that you guys know all the different organs of the urinary system, and their functions, what they look like. And then as I mentioned before, like the most important bits of renal circulation is renal artery and renal vein, and then inferior vena cava and abdominal aorta. I highly doubt that it's going to be anything more complicated than that, okay? Because that would just be very brilliant. Yeah, again, in the dissections, you can't really see much. There's only very, very minimal things we can ask you on it. As you can see here, there's a cortex, medulla, and pelvis that you can really clearly see. The hilum, if you dissect it, can't really see it. Urethra, as I mentioned before, it's like those internal, external sphincters. And then also the detrusor muscle, which is the component of the bladder wall. And then I think that's like pretty much it. And then the urinalysis stuff that I've already mentioned. All right, is everyone all good? Yes?
Yes.